What's going on, y'all? I am sore today because I had a hiatus from my leg workouts and got back on it today. 400 lunges, 100 um, squats, and then some hill sprints, just 5 minutes worth of hill sprints. And I am sore, so I know I'll be real sore. But I like soreness. I don't really care about it. But anyhow, if you've ever dealt with one-sided knee pain or even hip pain or something like that, then there's a very good chance that you're dealing with an imbalance that could, at least in part, be rectified by stretching. So I say that from experience mostly, but then also just kind of like knowledge, studying knowledge. But like specifically for me, my left knee, I've often in probably the past 10, 15, 20 years, intermittently I say experienced pain in this knee, not this one, but this one. And then even last, I want to say summer, when I started to run, I was running on the 400-meter track nearby. Now I will say one thing is that that track is like hard pavement, and it was like unforgiving. I could have, like when I was younger, I could run on that track and it'd be like whatever. But for some reason last year when I ran on it, it's like it hurt. It made my body hurt, pounding, but especially on my left side. So the thing I know about me is that I've dealt with some level of kind of like imbalance between my left and right side, and I think it's for one main reason. So I think that um, one of the I think the main reason can be attributed to, or I say one of the main reasons can be attributed to me dislocating my shoulder back in 2018. And so what happened was I had like a long time period where I was just kind of like this, and I was always having to sleep on this side. And apparently when you sleep on that side, I think it caused me to tighten my other side. But then I've also dealt with some level of like, I don't know if it was when it was in a car wreck some years ago, but like having some stuff like like in my neck or whatever, that kind of contributed to an imbalance in other parts of my body. But like I really think that the shoulder dislocation did a lot, because again I had months where I was wearing a sling and not using this side and favoring the other side, and so I think it caused this side to kind of tighten up a lot more and weaken, and because after that I noticed more pain, like I said, in the mainly in the knee joint, but sometimes even in the hip joint, and so then I also, that's why you'll see me doing this stretch right here. It's called the QL stretch, quadratus lumborum. It's like these muscles on either side of your back, lower back, that connect your hip to the lower rib cage, I want to say, on both sides. And I feel on this side it's tighter. And so what happens is when it's tighter, it pulls that hip up. And so that means it kind of hikes that leg up a little bit. And so I end up kind of like, maybe I think when I run, it kind of caused me to put a little bit more stress on this leg in a certain kind of way. And so all that said, me doing the stretches that I do is in part to rectify that. So even here, as I lean into this stretch, this hip flexor, I feel it more than this one. Okay, and then I also feel that QL right here, I feel that more than the one on my right side. And so my goal is to try to keep my body as like balanced as possible, in hopes that I'm stretching that tighter side more. Now, this is also why if you've been following my stretching videos, you've seen me kind of do other one-sided stretches. Because the thing is, if you really want to get rid of an imbalance, the best thing to do is to focus on one-sided stretches. So like even this here, when I do this one leg hamstring stretch, this leg, when I go into it, I'm not touching my foot the first time. You see? And so typically what I do is I just kind of pull in like so. That way I'm kind of leaning in, but once again I can feel it in that left quadratus lumborum. So I'm going to pull and feel that stretch along the back of my leg. Then when I go to the other side, you see I'm immediately able to touch it. Because this side I have more flexibility. Okay, so I'm going to lean into that, still get a good stretch there. But because this side is already more flexible than the other side, what I'm going to do is I'm going to repeat this side, but I'm not going to repeat this side. Still get a good stretch here, but I'm going to do twice as many stretch repetitions on the other side. See, these are the kind of things, if you really want to optimize your health, if you really want to kind of like optimize your movement, your fitness, all that kind of thing, you gotta get to the place where you taking the time to figure out the details, pay attention to the details, and that's something I'm really determined to do. I'm really determined to do that. That's the thing that makes some of these athletes like LeBron and Tom Brady and them kind of last so long, because they really pay attention to the intricate details of their bodies. Okay, so now I'm able to touch this one, but barely. I'm going to lean into that. I'm going to try to push into this one. Yeah. I don't know what it is, like, especially right there behind my knee on this side. It just feels very tight. Just get a good stretch in there. I saw someone on Facebook just today talking about how you got to stretch, because I guess you may have experienced like an injury, and I want to be like, yeah, I feel you, because like here in my 30s, my upper 30s, I have noticed it's like I feel tight. And I think some of it could be attributed to age for sure, but then some of it is attributed to the fact that I've long been one to exercise and not stretch well, if at all. And so it's like literally years of exercising without stretching. I felt tight. And so then I've pulled, over the past 5 years, I've pulled a hamstring a couple of times. Slightly, thankfully. So not significant, but slightly. And then I even felt soreness in one of my Achilles tendons once or twice. With that, I was like, definitely like, oh, I can't do that, because trying to keep those tendons from popping and stuff like that. You definitely want to be careful with that. Yeah. So anyway, just taking the time, pay attention to those little details, do some one-sided stretches. Oh yeah. And try to rectify, what causes that one-sided pain. So anyway, I'm just saying all that to say, if you've noticed over the years that you have a knee or a hip that hurts, it probably means that you're favoring that the other side is stronger, and you need to kind of do some stretches and or strengthening exercises to bring up that side to match the other side, or vice versa. You just kind of have to see. I just know for me, this side actually is needing more stretching. It needs stretching really a lot down a lot of this chain here on my side and in my hamstring and in my hip flexor, all that kind of stuff. I just know that this is tighter than this, and so that's what I'm working on. So try to pay attention to those details to kind of see what the case is for your body, and you be able to come and fix some of your issues. All right, you have a good one. As we get older, it becomes increasingly important to maintain and build muscle. Muscle helps you burn fat, stay mobile, and can contribute to longevity. However, many people have no idea how to work out to build muscle. My mini workout series on Patreon provides you with my body weight mini workout video library. These workouts use little to no equipment, which means that you can do them in the privacy of your own home. They start at beginner level and progress from there to ensure you continue to see results. Every workout is a full body workout, hitting chest, back, legs, and glutes, as well as other muscles in between. Become a patron today and receive access to my series of mini workouts, plus access to a digital copy of my book, 8 Weeks to Transform Your Diet and Your Health. By combining the workouts with healthy diet changes, as outlined in my book, you'll definitely be on your way to weight loss, improved health, and visible results. Join me at patreon.com/ShawnB2B Fitness today.